Today we're going to talk about infection prevention and infection control. Here we have our objectives. We're going to compare and contrast the various elements of the chain of infection, review the anatomical and physiological barriers that can protect an individual from infections, describe the signs and symptoms of an inflammatory response, local and systemic infections, and related diagnostic tests. Discuss the etiology of nosocomial infections, differentiate between medical and surgical asepsis, relate principles of asepsis and their application to the client care, differentiate between standard precautions and various types of isolation precautions, review nursing interventions that can protect a client against infection, and describe proper techniques that support infection control. Now we're going to discuss the chain of infection. There are 6 links in this chain of infection. It's a continuous chain that makes possible the spread of the infection or the disease. They call it a chain because breaking any link in this chain can actually stop that contamination from one host to another. So as part of the links, we've got a causative agent, any pathogen or microorganism like bacteria, virus, protozoa, prion, rickettsia, fungus, helminths, any of those that can cause the infection. Reservoir is the place where these pathogens grow, where they're found in the infected wound, in an animal or human waste, contaminated food or water. That would be a reservoir. A nice, wet, warm place usually is a really good place for germs to take hold and multiply. A portal of exit is the route that the pathogen leaves the body of the infected host and could be through feces, urine, sputum, blood, or other body secretions. It could even just be coughing or sneezing. A mode of transfer is the direct personal contact with the body secretions or contaminated soil or fluid. Could be indirect contamination through an inanimate object like contaminated eating utensils, drinkware, soiled dressings, hospital equipment that's contaminated. Vectors such as fleas, ticks, or mosquitoes where they suck up some of the blood and then they go bite somebody else. And droplets and aerosol are another way that can spread from one body to another. You also need a portal of entry, a way for these germs to get inside. It could be mucous membranes, nose, nose, eyes, mouth, through your throat, your trachea, or other bodily orifices. Any breaks in the skin are an opportunity for these germs to get through. A susceptible host. The host has to be susceptible. If there's a break in the skin, the immunity is low, or even just because of their age, this is a way for those germs to get in and take hold. Good health and hygiene practices as well as immunizations help prevent the susceptibility of humans to disease as well as the spread of infection. So even if they are exposed, they're resistant to that germ taking hold. Those are the chains of infection. The causative agent, the thing that causes it, the reservoir, a place for it to grow, a way for it to get out, a way to transfer to another host, a portal of entry into that host, a susceptible host that it can get inside and take hold and start all over again. This is your chain of infection. Stages of the infectious disease. During the incubation period, that infectious agent, it gets inside and it starts to reproduce inside the host, but there's no recognizable symptoms yet. However, this germ or agent can still, while it's reproducing, exit the host and infect others as well. The prodromal stage is when the host starts to develop initial kind of vague symptoms, maybe just a little achy fever, maybe a little mild fever, a little headache. The term malaise means just kind of a generalized loss of energy and just not feeling well. That develops into an acute stage. These symptoms become severe and are specific to the tissue or the organ affected. Now, it's worth noting that there's a difference between local and systemic infection. Local means just in the one spot. If you have just a local infection, it could be as simple as a little minor skin infection. Maybe you have a group of pimples in one area that are breaking the skin from picking and it gets infected in that area. That's just a little localized swelling, inflammation, maybe a little pus, or it could be even something like an infected wound, but that infection is contained in just that one spot. If it is a systemic infection, the entire body is affected. An example of this would be like tuberculosis or pneumonia. Even though it starts out in the lungs, as that infection takes hold, it makes the entire host sick. The white blood cell count goes up at this point. They may develop a high fever. A convalescent stage is when the symptoms start to subside as the host overcomes the infectious agent. After they've gotten some antibiotics and the host rallies and they're able to start to knock down that level of infection. The resolution is when the pathogen is finally destroyed and the health of the host is either restored or at least improved. Infection and infection prevention. So infection itself is the entry of a disease-causing pathogen or microorganism into the body. It disrupts the tissue and may result in illness and disease if left untreated. It is a condition that results when the microorganism causes injury. Medical asepsis is also called clean technique. This is different from sterile technique. It is just a clean technique. These are practices that confine or reduce the number of microorganisms. This is in contrast to the surgical asepsis, where they completely eliminate all the microorganisms or any contaminant. Medical asepsis or clean technique is what you use in everyday work at the bedside. Barriers are used to prevent infection. They can be some barriers that exist are anatomic or physiologic methods that stop the microorganism from causing the infection or getting in. Number one is intact skin, the body's number one defense against the spread of disease and infection. Barriers can be mechanical, physical barriers that prevent microorganisms from entering or expelling them before they multiply. So what are some physical barriers? You have mucus in your nose. You have cerumen or earwax in your ears. This prevents things from getting inside those orifices and taking hold. Even if they get inside, they're incapacitated and expelled before they multiply. We've already talked about intact skin. Your body produces antibodies that if an infection does try to come in, it kills that germ before it can take hold. Chemicals used to destroy or incapacitate microorganisms through natural biologic substances. I think these are things like your antibiotics. There's also cleaning and disinfection, physical scrubbing with soap and water, or the use of a disinfecting chemical or compound to clean. Standard precautions, you're going to hear about this quite a bit. This is a way to reduce the risk of microorganisms transmitting from both recognized and unrecognized sources of infection. By treating everyone the same or universally, you are preventing that spread. Even though you can't see that something is on somebody's hands, it can be spread through the hands, their clothing, sneezing, things that you cannot see. So treat everything and everyone as if they are potentially infected. Standard precautions. This includes hand hygiene, using personal protective equipment like gloves, gown, mask, shoe covers, keeping your hair tied back, keeping your fingernails short. It prevents the transfer of pathogens from one person, place, or object to another. Respiratory hygiene or cough etiquette. That means coughing into the crook of your arm, covering that cough or into a tissue and throwing it away. Safe injection practices. These are ways to prevent the spread. Hand hygiene, when done correctly for at least 15 to 20 seconds, you should be able to sing happy birthday 3 times. It is essential to prevent cross-contamination with infectious microorganisms. Can't emphasize that enough. Hand washing, hand hygiene, hand washing, hand hygiene. And here it is, hand hygiene. The most effective way to prevent cross-contamination is good hand hygiene. Gloves should be worn to prevent contact with any body fluids. Hand hygiene should be performed before and after patient care. Nowadays, we have the sanitizer outside the room or even inside the room. When your hands are not visibly soiled, you can use this several times over and over before contact, after contact. You can't really do it too much. Hand sanitizers are the most effective way to remove microorganisms from the hands of a healthcare worker between patients. If the hands are visibly soiled, however, you get something on them and you can see that you definitely need to do some hand washing with soap and water. And every I don't know how many times exactly, but you should do thorough hand washing in between several rounds of regular hand hygiene with the sanitizer. So the best way is soap and water. In between patients, the easiest and most effective way is the hand sanitizer if the hands are not visibly soiled. Health workers with direct patient contact should not wear rings, jewelry, artificial nails, or fingernails longer than a 1/4 inch, or even nail polish, especially if it's chipped. I think we're also saying not to have false eyelashes. They're especially long, they harbor germs, and they fall off onto the patients and in the patient's environment and cause contamination unnecessarily. Standard precautions. There again, this is treating everyone the same. It is the infection prevention practice applied to all clients, whether or not you know that they have an infectious agent on them or not. Methods for avoiding direct contact with body secretions except sweat include hand hygiene and PPE. Never touch anything that's wet from a body surface or body cavity that's not yours. PPE or personal protective equipment is required, and if you have to put on all of the garb, it is donned in the following order. First the gown, then the mask or respirator, then the goggles or face shield, and last the gloves. To take them off, it's in the reverse order. You take off the gloves first, inside out over one another so that you don't snap or flick it, followed by the face shield and goggles, then the gown, which you turn inside out over itself and roll up, and finally and last is the mask or respirator. There is a link on this slide. If you're going through the slides where you can see the narrative notes, you should be able to click on that link with a control-click combination, and you can watch the video for doffing and donning PPE and for the recapping of needles. Now, the recapping of needles, you almost never recap needles. It's highly discouraged because it is dangerous, but there are very few circumstances where you have to do that. And if you do, you have to use the scoop method. Disposal of sharps should always be in a sharps container. These are your needles, your scalpels, things or even your ampules that are broken. The glass, you need to put those in the sharps container. It needs to be replaced when it's 2/3 full. Don't wait till it's completely full, because then the little jagged pieces are sticking out and somebody could be tucking something in and poke their finger accidentally. Contaminated waste are some things that require specific disposal or biohazard waste. I'm not talking usual soiled articles, like not something that's like urine soaked, unless it is a biohazard situation like an MRSA contamination or something like that. These have to be sealed in an permeable plastic container, bagged in a plastic bag marked biohazard. Soiled liners are bagged carefully at the site inside the room, and the bag is closed prior to transferring out of the room. You never, never, never wear your soiled gloves that you just used to transport that bag through the hallway. After the bag is closed up, you take off the gloves, and then you can carry that bag through the hallway. We're going to talk about transmission-based precautions, also called isolation. or isolation precautions. These may be used in combination with standard precautions for certain situations. The nurse must also understand the different types of isolation and their uses for what specific conditions. Types of isolation are airborne, droplet, and contact. The airborne precautions is specific to reduce the transmission of very, very small, less than 0.3 microns. These pathogens are evaporated droplets that can remain suspended in the air and even attached to dust particles. They can travel long distances. So, somebody has some kind of infection like tuberculosis, for example, the people taking care of this person have to wear an N95 mask or a PAPR, which is a power air purifying respirator, to filter those tiny particles, because the particles are so small and they can travel so far. When you're anywhere around that patient, you have to be donning this kind of PPE. You put these clients in an isolation room. They get their own private room if they're hospitalized, and sometimes they're even in a negative pressure room to try to pull out some of those tiny, tiny particles so they don't go throughout the entire facility. Droplet precautions are measures to block infectious pathogens that exist as just moist droplets. They're larger. They're usually larger than 5 microns, so they can't travel as far. And when you cough or sneeze, it can go maybe 3 feet or less, but those moist droplets can cause contamination and can be, inhaled by the person standing close contact, less than 3 feet. They exit the host during coughing, sneezing, talking, and procedures like suctioning and even a bronchoscopy. So you have to wear a regular mask in this situation so that those moist particles don't go into your mouth, or maybe even goggles so they don't go into your mucous membranes of your eyes. Contact precautions. These are measures to block the pathogens that are transmitted via direct or indirect contact. So if someone's on contact precautions, you would have to actually skin-to-skin touch or touch a contaminated object or clothing or something that the patient has used. This would be gown, gloves, mask. Isolation can have a very negative effect on people, especially if they're in isolation for a very long time. The patient on transmission-based isolation is at risk for decreased self-esteem and sensory deprivation. You can imagine if there's a sign on the door that says, "See the nurse" or "the nurse's station" before entry, it's really going to discourage a lot of visitors. There's not going to be as much interaction with that client. And over time, they get very lonely, no stimulation. This would be sensory deprivation. Signs of this sensory deprivation would be boredom, slowed thought, disorganized thought. They kind of lose track of the days or what's going on out in the outside world. Excessive sleeping, anxiety, hallucinations, panic attacks, maybe even just hopelessness. You need to be assessing for sensory deprivation, and that needs to be ongoing for people that are isolated. What can the nurse do to help the patient overcome the sensory deprivation? You can listen to their feelings, make positive comments on their grooming and their activity, try to engage them in meaningful conversation, ask about their interests and hobbies. They are going to have very limited visitation, so make that visitation count. When you go in there, your patient encounters with that client, make it count. Spend a little time with them, even though you don't have a lot of time. Make them feel like they're not forgotten. Make visitors feel welcome and help them to understand that the patient benefits greatly from their presence. Teach the visitors how to put on the PPE so that they can go in and visit with their loved one or friend. Addressing self-esteem needs is important to complete recovery and regardless of the patient's age. Surgical asepsis. This is where you want a complete block of any microorganisms. This refers to measures that render supplies and equipment totally free of the microorganisms. There are some sterile techniques that can be used. We're going to talk about those. Sterilization is one part of this. Physical and chemical technique to destroy all microorganism, including the spores. This can be through heat, steam, autoclave pressure, or chemical, gas or liquid. Autoclave uses heat and steam and pressure. It's like a big old pressure cooker, and you put the instruments in there and it kills everything. There are also chemical, gas, or liquid sterilizers. Surgical asepsis principles. Once a sterile item touches something that's not sterile, it's considered contaminated. Any opened or partially unwrapped sterile package that you find is considered contaminated. Once it's opened, it's just a matter of time before it's contaminated. So if you find something that's open, you don't know how long it's been open, it's considered contaminated. If there's any question about the sterility, it's considered unsterile or contaminated. When you lay out a sterile field, you unwrap the flap away from you first, to each side, and then towards you last. The outer 1-inch margin of that sterile field is considered a zone of contamination. So you can touch that outer edge to turn your sterile field a little bit if you need to reposition it before you put your sterile gloves on. A sterile wrapper that becomes wet can wick those contaminants up through the drape of the supporting surface, the contaminants from the supporting surface causing contamination. Never turn your back on your sterile field. It is considered contaminated if it is left unattended, or if you're opening that sterile field and you turn your back, you didn't see it, so it's possibly contaminated. Coughing, sneezing, or excessive talking over a sterile field can cause contamination. Reaching across the sterile field can cause contamination. It could just be your sleeve or anything that's dangling that you're holding. Sterile items lowered below the waist are considered contaminated because they are not within the critical view. This includes your sterile gloved hands. Bacteria. There are two common causes of infection are bacteria and viruses. These are not the only causes, but those are just two common causes. There's also fungus and other things out there. Bacteria can be aerobic, that means needs oxygen to survive, or anaerobic, they can live without oxygen. Normal flora are non-pathogenic microorganisms that are present and prevalent on the body. We need our normal flora. It creates a healthy balance of good bacteria to prevent the bad bacteria from taking over. If you get rid of all the good bacteria, the bad bacteria just have more area to take over. So you don't want to kill all the bacteria. You want to keep your good normal flora. On your skin, there's always good bacteria as well as possible bad bacteria. And your intestines as well. You need that good gut bacteria to help break things down. You don't want the bad bacteria to take over. Killing all the normal flora along with the pathogenic bacteria can allow for opportunistic germs to take hold and flourish. Bacterial infections are treated with antibiotics. Frequent use of antibiotics can lead to antibiotic-resistant bacteria or superbugs because it kills all the bacteria. It's not selective for just the bad bacteria. So too much of a good thing, too much use of antibiotics, you run the risk of developing a superbug that's resistant to the bacteria, like MRSA, which is methicillin-resistant Staph aureus. There are also viruses. Viruses don't really have a cure, but you can control the symptoms. The spread of certain viral diseases can be prevented with vaccinations. Healthcare-associated infections are also called HAIs, or they could be called nosocomial infections. It's worth noting that colonization means a condition in which microorganisms are present, but the host does not manifest any signs or symptoms of infection. Many long-term care residents, hospitalized clients and healthcare personnel are already colonized with antibiotic-resistant bacteria, possibly with no symptoms at all. Health-acquired infection, also called the nosocomial infection, is an infection that occurs after the patient is admitted to the healthcare facility. So maybe they came in for some kind of a surgery and they develop an infection while they're in the hospital due to some kind of cross-contamination. It could just be from the healthcare workers in the facility not washing their hands and transferring some kind of an infectious organism into that opportunistic site, a surgical site, or maybe they put in a catheter after they were admitted and then they developed an infection in their bladder because that catheter was not put in correctly, or it opened up an opportunity to develop an infection. Any infection that occurs after admission to a healthcare facility is called an HAI, or nosocomial infection, especially if it's from a cross-contamination from infected people or instruments. Examples, common examples are catheter-acquired urinary tract infections, or CAUTI, C-A-U-T-I, ventilator-acquired pneumonia. So if somebody's on a ventilator, that tube goes right directly into their lungs, and that's an opportunity for germs to get in. Infected surgical sites we've already talked about, and even just their IV site, or especially a central line. Some gerontological considerations that we need to think about. Older adults are more susceptible to infection because of age-related decrease in immune system functioning. Risk factors like inadequate nutrition and fluid intake increase this susceptibility. Infections tend to be subtle among our older adults. It may manifest as just a behavior change or mental status changes, very, very slight. Before they even develop a fever, they can start acting confused or not quite themselves. Older adults tend to have a lower baseline temperature, so they may not even develop a fever. By the time they do develop a fever, it's probably too late. Infections are more likely to have a rapid onset and quickly become life-threatening. So you need to watch for those subtle behavior changes or mental status changes in our elderly. Other things like the thinning, drying, and diminished blood supply to the skin predispose the older adult to skin infections. You want to that's why we're always on high alert for any kind of breaks in their skin integrity. Visitors and caregivers should be adequately immunized. They make sure that all of our students are immunized and up to date on their shots, as well as their personnel, because they're around these older adults that are more susceptible. The older adults themselves need to be immunized. After age 65, they're supposed to get their pneumonia and their shingles shot, as well as the other immunizations. Visitors and staff that have either an active respiratory infection or possibly a respiratory issue, they need to either avoid contact altogether or at least wear a mask. Maybe if a visitor is thinking about visiting a loved one and they're starting to come down with something, especially respiratory, maybe just don't visit. And if they do, at least wear a mask. Here's our objectives again. Hopefully we've covered all those bases. And that's the end.